So you're not on your back a long time. I'd like to get over to your side.
Yeah.
So we're gonna check out her non-operative hip first, if you don't mind straightening this leg out.
Okay.
This leg, straighten out. Good, we just wanna see how much her hip is willing to move. Allow me to move you. Any bother there?
No.
So that's a fairly mobile hip, and that's what we'd expect. We'll check out a couple different capacities, how about that?
No.
We're gonna really challenge that hip.
No.
Pretty happy hip. We're gonna check for straight leg raise to see if there's some rotation that might be coming from her back. You just allow me to move you. Anything here?
No.
Renee, lift your head, look at your knee.
No.
Lift your head to look at your knee. Does that change anything in your lower
A
back?
little bit right in here.
Is that similar to where you feel symptoms when it
Yes.
bothers you?
Yes.
Lift your head again. Bothersome there, keep your head up. How about now, if we back your toes off?
Yes.
Still bothersome? Okay, you
Mhm.
can lower your head. Most of your bothersome symptoms are on that left side?
Yes.
Okay. So that could be significant. We're gonna check out what her right hip is like. Bring this up. This is the hip that you had operated on?
Mhm.
There's still some stiffness there. They go through the back or the front?
Right now it doesn't hurt at all.
Did the surgery go through the back or the front?
The back.
Back, okay. We're gonna check the strength of your legs. Pull your toes up, hold your legs up, hold your toes up, hold your toes up. Good, hold your feet up. Good, all right, thank you. Would you be up for lying on your tummy, please?
Pardon me?
Would you lie on your tummy, please? I'm gonna get a towel quick. So she's got some irritation through that left hip a little bit. When we straighten her leg up, she's got some tightness in through the left hip. I'm sorry, right hip is a bit tight, left hip is a bit tight as well. So we want to see if we can't smooth those out eventually for her to be able to walk better. We're going to take a closer look at her back. How are you lying right like this? Is this bothersome?
No.
I'm going to flex this table up just a little bit.
Okay.
Not sure why that doesn't work. Maybe I won't. There we go. So these tables have multiple adjustments for us to do customized work. So I'm going to apply pressure about this much, real light in different areas, and you let me know if there's anything that seems to be bothersome in that area or if it seems comfortable. Any bother right here?
A little bit, yes.
Is that similar to the type of pain that you get when it bothers you? Or is that different pain?
It just feels tight.
How about this?
No.
So I'm going through those vertebrae one at a time, through those lower back vertebrae. How about here?
No.
Pretty good motion there. How about here?
No.
Here?
Nope.
So we're going up a little bit higher. This would be that main syndrome, if you will, if there was some indication of tightness in this area. So the mobility definitely increases up higher. You feel that as well?
Yes.
Okay, now I'm going to go a little bit off to the side. What about here?
That does.
Is that similar to the type of pain that you get when it bothers you?
Yes.
Okay. And how about here?
Yes.
Here?
Not as bad.
And how about in this side?
No.
Here?
No.
Here?
No.
So the most bothersome areas seem to be this area here.
Right there.
Okay. So what I'm going to do is, and that's very similar to the type of pain that you get. Is that correct?
Okay.
I'm asking. Is that pretty similar to the type of pain that you get?
That's really tender.
Okay. And it's familiar pain to you, right?
Yes.
Okay. So what I'm going to do is some gentle work in that area, see if we can't improve that, and we'll test that when she comes up to standing. This is called graded mobilization. I'm using very gentle contact now. And what I'm intending here is over the next 30 seconds to a minute and a half that area starts to relax and calm down a little bit and become more flexible and less irritable.
What are you pushing on?
So this is the right side L5 over the tissues there. When I press on an area, my intention is to work with that vertebrae, but there's a little bit of echo of movement through a couple of vertebrae up and down. This is called graded mobilization. It's a joint mobilization technique. What I'm doing is stimulating the joints and the nerves in that area, basically to calm down, so that it can increase flexibility and release some happy pain-relieving chemicals in that area, which allow for a space for her to move better, more comfortably. What do you notice, Renee, as I continue to work here?
Yes,
Yes, what?
it feels better.
Good, it's starting to soften up. I'm doing the happy dance inside. This is working out. It's a little more nerve-wracking when you got people looking at you working, but this works predictably enough, and this is very common. And how somebody responds, right?
What's hardest for me when they do something like that on this shoulder is every once in a while, and I've had several of you work on it, just relax when we work on this. Just relax when we work on it. You tend to want to protect yourself.
Right, for sure, right? Well, it's with good reason. I mean, if an area is bothersome, you have to develop a lot of trust in the person that's going to be
But you do have to
perturbing your
relax to
system.
have you work on it, right?
Perturbing the system, yeah.
Yeah.
For usually in the backs, it's not hard. I mean, someone
Okay.
lies in their tummy, they don't have to. It's hard to resist here.
Okay.
Right? And if this approach isn't comfortable, we go to a different area or try something different, or you know, you'll see there's more than one thing that we can do. So I'm really happy with that approach here. So now what we do, we call that a trial treatment. So now what I'm going to have you do, Renee, come on up to sitting. And then just, sit on the edge of the table here, either way, or lower the table. Sit for a moment. Just when you get up, just careful with these cords.
Okay.
So then when you feel ready, come to standing. What do you notice in standing at this moment?
It feels a little better. All you did was put that light massage on there.
If you would please, you're here. If you don't mind, let's just test that forward bending, see what that's like now.
Bend forward.
Sure. Your $20 is underneath. That's an exceptional outcome, right? The thing I'm most happy about is that's changeable, right? So I did a joint mobilization technique, and we do this every day, all day here, right?
Yes.
And there's lots of questions I know you have, and I'll slide that right hand down the right, which is probably bothersome, but forward. A lot more mobility in that direction,
Yes.
and a lot more mobility in that direction.
Wow.
I don't know where you'll be with backward bending, but let's check it. She's gonna do the limbo. I know I'm calling for the Mardi Gras party.
That's even better too.
Right, so
Wait, I'm gonna lay back down here. You just
Whoa,
keep
yeah,
doing
you-
that.
You can talk, but keep working, so,
Okay?
thank you so much, I just careful
Yeah.
here, so outstanding, thanks Renee.
Thank you.
So that, I'm always happy when that turns out. Here's the thing, the good news is that's changeable. We've just demonstrated, right? I chose one technique to work with her, there's others we could have chosen. Based on a reasonable understanding of how her body works, the sort of things she came in with, it was a customized examination. In an official examination, I'm gonna be a bit more thorough, of course, right? But that's a very gentle technique. There's a range of techniques that can be used at any individual joint to help influence, and from those gentle techniques to stacking and cracking, like we know from adjustments or manipulations, right?
So what actually are you doing? Are you massaging that?
I call it internal joint massage. So when you move those joint surfaces together gently, it stimulates nerves in that joint to allow for a whole slew of changes that occur. One is a relaxation of the nervous system. Another is different type of impulse to the nervous system, different type of sensation other than pain. There's happy chemicals that are relieved with hands-on work like that, like endorphins and enkephalins, the body's own opioids. So there's a number of neurochemicals that happen that cause that change.
Is that something that you would use dry needling on?
We could use dry needle on that for sure, that might be really helpful. right? So I'm mechanical in nature, I'm a doctor of physical therapy, like I wanna see people physically moving better. So there's lots of ways to relieve pain, right? I mean, you can get a good, nice glass of wine, bubble bath, nice massage, those are great ways, right? Medications. On the tail end of that, there needs to be a way to get someone to the point where they can more comfortably and confidently do the things that they wanna be able to do. Walking, standing, stooping, gardening, pickleball, whatever it might be, getting up and down from the floor, right? That's the important thing. So now that creates a space and time that we can start to talk about, hey, maybe there's a specific exercise that you can do. And there would be. We teach her to do a couple focused exercises to keep that thing moving along. Her body probably wants to pull into old patterns, right? So it's not gonna be a one and done necessarily, but we want, if it could change here within a simple technique like this, like that's we call it good prognosis, right? So that's meaning there's a high likelihood that a reasonable treatment plan and you get significant progress from that. So, yes,
Does inflammation have to do a lot with this?
I think at the root of this is nervous system inflammation, right? Caused by inability to move properly, caused by poor posturing, caused by lack of exercise. You know, too little exercise can cause inflammation, but ultimately that nerve is irritated, and inflammation is part of the process.
Can you use hot and cold on that?
Hot and cold may help it feel better. It doesn't get to the root of the problem, but it can be helpful. Like if people want to use a little heat rub or cold packs, that sort of thing, that's fine, right? I'm not against that, but ultimately we have to teach joints to move better. We have to teach the muscles in that newfound range to be stronger. And the most exciting part of it is at the end, we want to teach, like really get those muscles strong, right? So we just follow this natural plan of care, right? I think it's posted right behind me. We'll have a bigger one, but it's first stage is relieve some pain and inflammation. Second stage is to correct the imbalances that brought that into that existence. Third stage is getting to the point where we strengthen those muscles in their newfound range. And then the final stage is teaching that person how to become a more resilient human being. Teaching them a couple of simple things they can do every day for pain relief and flexibility, and maybe a couple times a week. Maybe some more vigorous activities that get those muscles strong so that the bending, twisting, and such are done more confidently. So that you don't have to be afraid of moving. That's the whole point, right? So it's a natural progression in the plan of care. So